please describe briefly in simple words that what is dexamethasone?
Basically, dexamethasone belongs to a corticosteroid. Normally, body produce corticosteroid through adrenal glands, which are present on the top of each kidney. These are the small glands produce these hormones. So these are the endogenous type of hormone. So in 1957, it was first made exogenously or synthesized outside by a Phillips Salter Hench and was approved for medical use in 1961. It belongs to a list of essential medicine of World Health Organization. It is the most important drug and used in entire world. It is used in different conditions like skin problems, meningitis, like brain problems, allergies, different type of allergies, eye problems, similarly infections, different type of infections of gastrointestinal tract, like inflammatory bowel diseases. The long-term use of this drug may result in different complications like bony pains, cataracts, problem in the eyes lens, muscle weakness. So we avoid to use these drugs for a long period of time. And there are also a number of complications of these drugs. We avoid to use these drugs in different fungal infections, with different type of vaccines, and with malarial drugs or the cerebral malaria. This drug has a very good anti-inflammatory and immunosuppressant effect.
Wow.
So it has its role increase nowadays.
Right.
So basically, this is a hormones that produced by a body.
Sorry, Dr. Farhan, so what I'm saying is this, as you explained dexamethasone very briefly, thank you for that. What I'm just concluding for this little brief answer just that, it is the medicine which is used for multi-diseases?
Yes, this used in a different type of diseases.
Right.
Like rheumatic joints diseases,
okay,
like cerebral problems like meningitis, autoimmune diseases. Similarly, that's the gastrointestinal tract problems like inflammatory bowel disease. And similarly, we use this drug in the respiratory tract diseases like asthma, chronic obstructive pulmonary diseases.
Wow.
In the cardiac problems like myocarditis, pericarditis, heart problems. Wow. And similarly, in some renal failure, we can use this drug because this is a steroid and this have a multiple utilization.
Wow. Dr. Farhan, my second question is this sign of hope for this pandemic?
Yes. As COVID-19 is a viral infection, it affects all organs of body, like brain, lungs,
right?
And in the lungs is the main targeted organ of the COVID-19, which presents with a viral pneumonia, with a shortness of the breath, cough, fever, and that leads to acute respiratory distress syndrome, which is the end stage of the lung failure. So as the viral infection involves other organs, heart, that's present with the myocarditis or the heart attack, myocardial infarction, and similarly the renal involvement or the renal failure, or that's the involvement of the gastrointestinal tract with the features of loose motion, abdominal pain, epigastric discomfort. So the COVID-19 is the multi-organ disease or which leads to a multi-organ failure. In this disease, dexamethasone is a good drug, but its utilization is limited according to WHO or according to studies for only lung involvement. When there is a involvement of the lung or there is a shortness of the breath or oxygen saturation is decreasing, so we can use these drugs. But these drugs we cannot use in the mild to moderate cases, as COVID-19 presents with the asymptomatic presentation, with the mild presentation, with the moderate presentation, or with the critical condition. So its indication is not in the asymptomatic phase, in the mild phase, or in the moderate. Only those patients which those requires the ventilatory supports or their oxygen saturation is decreasing or critical. So in those cases, we can use these drugs. So the utilization of drug is on very carefully, because there's a number of the side effects of these medicines.
Right.
Yeah,
please go ahead.
Yes. So as the UK-based study research regarding Dexa streamline the basically utilization of this drug. As these drugs, we are using these drugs in the other name with methylprednisolone in our patients for a long period of times. As that first case of the COVID-19 diagnosed in Pakistan, 26 February 2020, and from that time, and we in the critical cases we are using the steroids, but this steroid was
Dr. Farhan, Dr. Farhan,
yes.
As you know that's I've been in the UK for the last 15, 16 years, right? And when this pandemic hit UK, around about 42,000 people has been died, right? The last 3 days before, the doctors concluded that out of 20, 19 patients recovered for this dexamethasone. So, I mean, this is the big sign of relief. Do you think that? Yeah.
Yes, this is because that's as COVID-19 is a basically viral infections.
Yeah.
That's in the later stage leads to a cytokine storm.
Okay.
The body responds against the virus entry, release a different type of inflammatory markers.
Right.
These inflammatory markers leads to a hyperactivity of the immune system, and that leads to a septic shock or different types. So basically, steroid in the case of cytokine storm is a good result.
Right,
So,
Dr. Farhan,
message-
Dr. Farhan, another $1 billion question. Can you please tell me any alternate solution formula if dexamethasone is not available in the market?
Okay. Basically, steroid is divided into 3 groups.
Right.
That's the short acting,
Okay.
and that is the intermediate acting,
Okay.
and that's the long acting.
Okay.
So dexamethasone basically belongs to long acting drugs because its effect is long.
Okay.
That's up to 12 hours.
Right.
So if the dexamethasone is not available,
Yeah.
we can use other steroids
Okay.
like methylprednisolone, that is the intermediate acting,
Right.
or short acting steroid hydrocortisone.
Okay.
These are easily available in the market.
Right. Dr. Farhan, the last question, not the least. Before I take you on the phone call, there is one doctor, Dr. Shanze. I've asked the same question from her, alternate solution formula, and she said the same answer, the one you gave, that dexamethasone is basically anti-allergic, right? So in the market, there are plenty of anti-allergic medicines at the moment, right? I'm just saying that I'm praising you guys, doctors, Dr. Farhan, you and Dr. Shanze, you. These type of people, if you come on the TV and the radio channels, they should educate the people, citizen people. The last question, which is my concern, why medicines get short in need of surgery, Dr. Farhan?
Actually, this is a problem in our country. In Pakistan, we are already facing this problem in every emergency issue. When demand increases, the supply of that specific artery gets.
But Dr. Farhan, can you please, can you just imagine, 4 rupees injection is not available in Rawalpindi, Islamabad, and the people who got it, they got 100% profit on it. I mean, these people are murderers. Do you think that?
Yes, you can say, because that's actually there are the 3 type of people are involved in it. For
Yeah.
black marketing, just to increase the price and to get a more profit.
Yeah.
like manufacturer, supplier, and the distributor.
Yeah.
So when demand increase, they reduce the supply
Yeah.
to get a more and more benefits or more and more profit. I think there is some miscoordination among these group. Maybe this miscoordination among these group of people,
Yeah.
and it can lead to increase this issue. So we can improve by producing awareness among the people.
Yeah.
So this is not a emergency drug, or this is not a life-saving drugs.
Okay.
Because there is a misconception among the people. So
Yeah.
when there is some misconception among the people, so they try to arrange or deposit or save these drugs to get a more and more
Yeah.
benefits. We can use other drug in case of shortage of the dexamethasone,
Yeah.
like methylprednisolone, beta-methasone, and like hydrocortisone.
Wow. Dr. Farhan, for the viewers who, obviously it's a national language channel. My program is in English, but the people who can understand Urdu, if you just can describe some medicines, the one you just said that in Urdu, in just 1 minute, so I can conclude my program. Please go ahead.
Yes, पाकिस्तान में डेक्सामेथासोन अगर शॉर्ट हो जाती है तो ये डॉक्टर ने फैसला करना है कि कौन सी दवाई मरीज को मिलनी चाहिए। तो इसलिए मरीज के अटेंडेंट या बाकी लोगों ने फैसला नहीं करना होता। तो डॉक्टर जो है उसे पता होता है कि अगर, क्योंकि ये डेक्सामेथासोन एक लंबी इसका इफेक्ट जो सा होता है वो लंबा होता है। मिसाल के तौर पे अभी ये इंजेक्शन दिया, इसका लंबा इफेक्ट होगा, हो सकता है 12 से 16 घंटे तक रहे। तो हम इसकी जगह दूसरी दवाई भी यूज कर सकते हैं। और दूसरा एक मैसेज देने का ये है कि ये डेक्सामेथासोन कोई ऐसी दवाई नहीं है जिससे कोविड खत्म हो जाएगा। ये सिर्फ उन लोगों में इस्तेमाल की जा सकती है जो बहुत ज्यादा सीरियस कंडीशन में है और जिनमें बहुत ज्यादा इन्फ्लेमेशन या इन्फेक्शन फेफड़ों में चली गई है। तो ये एक इन्फ्लेमेशन को कम करने की, यानी सूजन को कम करने के लिए यूज हो सकती है। और इसकी अल्टरनेटिव दवाइयां बहुत इजीली अवेलेबल है, जो कि प्रेडनिसोलोन डेल्टा कॉटल के नाम से भी मिलती हैं और मार्केट में सोलोपाटिक के नाम से भी मिलती हैं, हाइड्रोकॉर्टिसोन के नाम से भी मिलती हैं और इसके अलावा सोलोमेडोल के नाम से भी मिलती है। इसलिए ये जो मार्केट के अंदर एक कंडीशन क्रिएट की गई है, पैनिक सिचुएशन क्रिएट की गई है और लोगों ने इतनी सस्ती दवाइयों को जो उनसे
Dr. Farhan, believe me, I've researched this medicine myself for the last 3 days, right? My friends from UK, they called me that there was a breaking news going through on the BBC channel. They did call me, that was evening time in Pakistan, and I went myself, and I'm searching for the last 3 days. What I can say, I'm really thankful to you both doctors, Dr. Shanse and Dr. Farhan. You guys, amazing. Dr. Farhan, especially you are on the front line. You are the front line warriors for this pandemic. Look after yourself, your family, and definitely after this program, it's going to be the eye opener for the people who are dealing with this COVID-19 drug mafias. And believe me, Dr. Farhan, I will keep chasing this